Good morning, everyone. I'm Brian Dixon. I am the interim director for our Center for Biomedical Informatics, and I am delighted to present to you the state of CBMI. The presentation was put together not just by myself, but our whole team in CBMI. So I want to thank all of the staff in CBMI who contributed to share information about our various program areas in the presentation. So even though I'm the one speaking, it represents the entire center and all of our activities. So I just wanted to make that clear as we get started today. So what I'm going to talk about, and that we'll have at least 15 to 20 minutes probably for discussion at the end. So I welcome your questions and comments. So especially if I get anything wrong as we go through, staff, please, and investigators, please correct me so that we get the truth out there, but try to represent everything as accurately as possible. But I'll talk about CBMI, our mission, our program areas, our people, introduce some new people and transitions. The information is largely from FY24, so that's the fiscal year that we're in now that's going to end here in a couple months. But there is some information that are right around July 1 of last year or so, but a lot of it focuses on newer things that are happening in CBMI in terms of projects and our impacts. And then I'll talk a little bit about our goals for this fiscal year that we're in, because we're still working on them. And I'll talk a little bit about kind of some upcoming things and future directions for the center. So first, these are our current mission, vision, values for CBMI. We seek to improve the health of people and their communities through biomedical informatics innovation. These date back quite some time. So now that we have a new strategic plan at Regenstrief, we may revisit these this year to see if we want to make any updates to them. Our vision is we envision a world where innovations in healthcare technology meaningfully improve the health of people and their communities. And we have values that include the people, so that includes our own staff and investigators, the health, of course, promoting health and well-being, innovation in terms of research and development, translating our work into practice, collaborating with partners, and we have a number of partners around the world, and then education, so training the next generation of informatics researchers and informatics officers, if you will, within healthcare systems. So CBMI has a number of program areas that we focus on. Biomedical informatics, of course, as a discipline, is pretty broad. It goes everywhere from the gene to the population. And so we have a number of program areas where we focus our efforts. Clinical informatics, of course, is what I think CBMI is largely known for, pioneering work in EHR systems and development and implementation here and around the world. But also our global health informatics team kind of carries the banner globally outside the U.S. On that front. Our public health informatics team focuses on what I call domestic public health, working with state, local, tribal, territorial health jurisdictions across the country. We have a newer dental health informatics program area that we'll talk a little bit about today. Learning health informatics, which is informatics to support learning health systems, and then AI, machine learning, and analytics. So thank you, Susan, for getting the ball rolling with transparency around where we spend our money. So our core budget, our draft for FY25 that's been submitted to Regenstrief leadership for review. The majority of it is going to support our core staff in the center, our center director, our director of operations, and our PAs that support the work. The program assistants do amazing things to support all of our research. So that is the bulk of our spending. We also have funds, just like the other centers, for faculty development, hospitality, and which mostly goes for recruitment and when we host visitors. Our corporate membership to the American Medical Informatics Association is a component of that. That allows us to sponsor events at the AMIA Annual Symposium. It also allows for things like the Clinical Informatics Fellowship Director to attend the Clinical Informatics meeting in May and provides for a registration for our Director of Center Operations to go to the AMIA Symposium, et cetera. We also have then some other expenses like everywhere else, some software licenses and office supplies, et cetera. I did want to highlight some of the newer grants that we have and sort of the Regenstrief subcomponent to that, because that's a big part of what we do here as investigators is we get grants and we have subcontracts to pay for our Regenstrief team. So Sean, for example, his track PCC, which was awarded about a year and a half, almost 2 years ago now, I think, we just submitted our year 2 kind of report in progress / funding request for year 3, but that's focused on long COVID, and it has, we'll talk a little bit about it, but it has both passive and active arms. Digital Square is a big funder of our global health informatics team, so Paul Bionich is the PI for that, and that is a contract that's directly to Regenstrief. Then Vision, the second iteration of the Vision project, which is focused on vaccine effectiveness, that's Sean's. And then I'm the PI for a project that's focused on diabetes in children and young adults. In terms of our overall progress, we've submitted proposals this fiscal year, totaling over $30 million in proposals, of which more than half of that has an RI subcomponent to it. And then based on the awards, so far in this fiscal year, we've received over $10 million in funding, with more than half of that involved in Regenstrief subcontracts. So progress. Let me talk a little bit about our team. So the core, of course, what we do here at Regenstrief and the CBMI is the work that all of us are doing, the work that all of you are doing in terms of supporting our mission and vision. We have some new staff that we've hired to the center over the last during this fiscal year. Zach Van Duzer is a new project manager working with the dental health informatics team. We also are delighted to have Sneha transfer from IUPUI to CBMI. So that was relatively recently into a PM role with us. We're delighted to have her on our team. And then Stephen O'Brien, who's been at the Institute for a while, was promoted from Project Coordinator 1 to Project Coordinator 2. So we're delighted to see Stephen's growth and really enjoy having him work to support our projects as well. In terms of faculty, we have one new hire so far for this fiscal year. Jill Industro, Dr. Industro, who's down here, just started in March, like 1 month ago. So still relatively new to us. Of course, she's probably familiar to many of you since she was a medical informatics fellow at the VA prior to joining CBMI. So we're really delighted that we were able to essentially retain Jill, if you will, from our MI program in the VA to a faculty position here at IU in the School of Public Health. We also have newer trainees that have joined us. Mashiri Wandai joined us in the fall, in October, I think, and is working with me on a number of projects. If you haven't met Mashiri, he's sometimes the only person on the 3rd floor. So go up and say hi or invite him to come down if you guys are having a meeting on the other floors. Madeline Payton is a new pre-doctoral fellow in our training program in public and population health informatics, and she is getting her PhD in biostats. Mackenzie is also a new PhD pre-doctoral trainee in our program. She's in the Health Policy and Management program at the Fairbanks School of Public Health, and her work is focusing at the intersection of HIV and informatics. Dan Riggins is a postdoctoral fellow with us who's working on a number of maternal child health projects. And he came to us from Chicago, and he did his I think his pediatric residency training here, and then came back to us for the postdoc fellowship. Dan, it's great. He will be transitioning out of the program this summer, so we're really proud and happy with the work that he's done. He's going to be taking a position with Eskenazi Health, so he's still going to be around and available to collaborate with us, but he's in a state of transition this summer, which we're excited about for him. Hannah Mandel just joined us in January. Hannah came to us from Emory, and she is working, where she did her PhD in epidemiology. She is going to be working with Michelle Cody and David Hagstrom as mentors for her in our program. And so she's also relatively new and still getting integrated. So say hi to her if you see her, which she's here today. So that's exciting. So those are some of our new folks in the center. And now I want to talk a little bit about some of the honors that we've sort of celebrated over the last recent bit. So Thongam, who heads our dental health informatics program, became a fellow of the American College of Medical Informatics. And for those of you not familiar with FACMI, it's sort of the really the top level college of fellowship within the American Medical Informatics Association. It can take some people multiple times to be nominated before they're accepted. Thonkam's work is really outstanding, and we were really excited to welcome her into ACME last year. At the international level, through the International Medical Informatics Association, there's the International Academy of Health Science Informatics. Bill was one of the folks who nominated me, which I appreciate. Sean also was nominated and accepted into the International Academy last year. So that's recognition of the work that of our faculty, not only that we're doing in Indiana, but around the world, because you have to be engaged internationally for that academy. So now for the fun part, where I get to talk about some of the exciting projects and work that we're doing in CBMI, where we are working to create impact both in Indiana and beyond. And here I want to recognize that these images came from our fantastic PR team at the Institute. So as many of you know, when faculty have papers accepted or going to be making presentations, our PR team will make press releases and do social media around that. And sometimes they'll create graphics to help people understand the kind of top line importance of that publication. And so I just want to publicly thank our PR team for the outstanding work that they do to promote our science and our work. All right, let me start with Learning Health Informatics program. As I mentioned, this is our program that really focuses around informatics to support learning health systems. Titus Schleier directs this program for us, and that program has been focusing on several disparities-related work this past year, including a Healer grant with IU Health that's focused around creating health disparity performance measures that health systems could use to sort of measure health disparities within their population, and then use that information to drive action within the health system. And similarly, Helen Chen, many of you might know Helen, who's one of our postdoc fellows, has a pilot award along with Titus to focus on disparities in type 2 diabetes populations. And so that's another thread of their work this past year. Similarly, they've been engaged with a number of partners to do their work because, as many of you know, to do learning health systems, you have to have the health systems engaged with you and people within those health systems committed to making change. And so they've been working with people locally like Dr. Tucker Edmonds at IU Health, as well as Eskenazi, and as well as institutions beyond Indiana to get work going. That includes some of the work that Dr. Mike Usher, who's an affiliate with us, he's now in Bloomington, and working with IU Health facility down there, and engaged in our activities through the program. Dental Health Informatics had a lot of information to share. I won't read all of this to you, but they've had a number of changes, including sort of recognition now at the School of Dentistry level of informatics as a key component of the work of the School of Dentistry. So Thonkum now directs the Office of Dental Informatics and Digital Health, which means that there's a real focus from the school on doing more things in informatics, which is great for us because I think that's going to really just strengthen further the relationship we already have with the School of Dentistry. So they've had a number of organizational changes there, and including dedicated, office space and a division within the school. In terms of education and training, they've also been working with the Luddy School of Informatics and other schools to create educational training program at the intersection of dentistry and informatics, which is fantastic to see that grow on our campus. And of course, they've been active scholarly with translating their work into publications. And so this is one of their more recent publications looking at prediction algorithms for Sjogren's disease using matched EHR and dental data, which of course came from Regenstrief, which is fantastic. So they're using Regenstrief, I think, trying to use Regenstrief to its full potential to support the work that they're doing in dental health informatics. Similarly, they've been very productive in terms of writing grants and getting funding. So they have now not only an R01 that is in full swing, where they've actually they now got copyright. They've developed stuff with our technical team here at Regenstrief and are pursuing that as in terms of testing it and then piloting it and then eventually working on an implementation grant to push it out into practice. But they also now have a UO1 as well to really build more activity and research around Sjogren's disease, which is fantastic. And also that program has grown from just kind of Thonkum beating on everyone's doors and reaching out for collaboration. And now we have Dr. Shuning Lee and Dr. Grace Gomez, both within both investigators, or Grace is an investigator in CBMI and Shuning is an affiliate within CBMI. So really building out that team of investigators to focus on dental health work, which is fantastic. Now I'm going to pivot to talk about our global health informatics team, which is really focused on impacting care and outcomes around the globe, and some of the things that they've been up to, including having a eHealth Leader Forum, which kind of falls under the umbrella of what we call Open Health Information Exchange, or Open HIE. And this, they had their first face-to-face meeting for these leaders, which really draws from a number of countries, and also developing communities of practice. And one of them is around data use. So they really worked with multiple country leaders to form the DUC and create toolkits that other countries then could utilize for implementing HIE in their country, which many nations now are actively trying to move forward with their HIE plans. Some of them have already implemented things, and those are stories that our global health informatics team is gathering and sharing with others. So there's a huge amount of activity happening outside the US in terms of interoperability and HIE development. The other thing is that they hosted their annual Open HIE conference last year, and it was the largest of its kind. So they started this pre-pandemic. Of course, it took a little hiatus during the pandemic, and now has come back full swing with huge participation from nearly 300 people across more than 30 countries. And people are sharing their progress, as I mentioned, on those activities in their countries, which is fantastic to see. I went to the events in 2018 and 2019, and many countries just had plans. They had digital health strategies that they had developed with their Ministry of Health. They were thinking that they were going to do this. Now they're doing it, and it's just amazing to see the work that they've done. And we've got a little video from the conference to play for you, so you can kind of see what that meeting was like. So I know it looks on the, so I love that video, and it may just look like a bunch of geeks standing around computers, but that, which is kind of what it is, but they're sharing code, they're sharing ideas, they're talking about what they've done, and it's just a phenomenal activity. And so we have a lot of staff on the team that are involved in keeping that community going, and we have funding from international partners to believe in that mission and work, and it's just fantastic that they're funding our efforts and our partners' efforts to make that community move forward, which is awesome. So if you ever have a chance to get engaged or go to the Open HIE events, I would encourage you to do so. All right, now I'd like to switch gears and talk about our work in public health informatics. I mentioned that Sean is leading what's called Vision. We have 1.0 of Vision over the last several years, and last year we kind of transitioned into 2.0. Our work really got started with COVID-19 vaccine effectiveness as it was being rolled out and administered across the U.S. And now it has shifted to include influenza and RSV. So the COVID team at CDC got merged into a larger center that's focused on respiratory illnesses writ large, and it's called CoreVid, I think is what they call themselves, at least for another 6 months before they reorganize. And they focus on a number of diseases. And so locally, we're working very closely with the Department of Health, IHI, and others to gather data from across the state. We provide that in a de-identified way to CDC in order to be part of a national network where the data can be looked at in terms of vaccine effectiveness. So really important work. This work has been presented to ACIP, which is the American Committee for Immunization Practices. It typically goes to ACIP first to influence policy and practice. Then we publish papers on it in MMWR or another journal. So Sarah Weehee, wherever you are, you'll be seeing this data now that you're on ACIP. And I think that, to me, that's the really highlight of this work, is the influence on ACIP's decisions, more so than the publications that we have coming out of the project. Similarly, now we're pivoting from acute COVID to long COVID and working with a number of folks in the Center for Health Services Research and IUCAR on this project to study long COVID and its impact. So look at the prevalence and incidence of long COVID, both in Indiana, and it's a multi-state network through CDC. So similarly contributing de-identified data to be joined up with the network data. We have the VAs involved. We're getting ready to actively recruit patients there, along with our active recruitment that's already started. Here, our pediatric recruiter is amazing, and we've got more pediatric patients already enrolled than any other site in the U.S. That's part of this study, and so it's just phenomenal. And then Parkview is partnering with us, and they'll be recruiting patients as well. So in terms of a partnership project, this is a great one. We're working very closely too with CTSI and their Research Jam team. I'll put in a plug for them. If you're thinking about doing a study where you're enrolling patients, Research Jam is a great resource that we have available to us through the CTSI. They've been amazing and have facilitated a number of forums with patients prior to us launching our active recruitment to get input from patients about what's meaningful to them, why they would want to participate in a study of long COVID, what messaging would resonate with them, and have really been helpful to get that patient voice represented in our basically study materials. And so this is a multi-year project and will continue. Again, one of our values is education. In CBMI, this is a more recent update of our training program. You see Madeline in there, along with Hannah and Mackenzie and some of our existing trainees. Dan is in there, along with some of the faculty, our faculty in the back row. Some of them, Thonkum and others, couldn't be there that day. But we've got a great training program in public and population health informatics. This is, I want to now highlight some of our alumni. Christina, who was a postdoc with us, is now an assistant research professor at IU School of Medicine. Helen Chen, who I mentioned earlier, she's currently in a research scientist position with us at Fairbanks, and she's an affiliate with us in CBMI, so been able, so she's continued on with us as well. And then Opie Ojo, who is in the pre-doc program, she's not on the T15 any longer, but she's still a research assistant working with me, and she's finishing up her dissertation this year and will be transitioning into a faculty role at Fairbanks later this year. So we're really in the Department of Epidemiology. So we're really excited about being able to keep Opie and continue to work with her because she's fantastic. All of our alums have done great and gone on to great places. Last year, we launched a summer institute focus at the School of Public Health in partnership with Regenstrief, focused around public health informatics, epi and biostats. We're continuing that program this year, so we've added more training. It's a week-long, they're week-long courses, half-day courses, so that would allow public health. This is targeted towards public health professionals. So other places do this, but we were like, we need this in Indiana. So it allows, for example, someone at the state health department, to go to one class for half a day a week, and then they can still work, which is helpful to public health partners. Sometimes they don't want their employees to be gone, for weeks at a time or enrolled in a big graduate program. But they're nonetheless, they can take 1 or 2 classes that week. We've added new classes. We had classes last year on R, on SQL, on how to translate data and use it to communicate effectively in public health. So we're really excited to continue this program, add stuff to it. And so if you know people who are working in public health, encourage them to take a look at it and maybe sign up, because this arm of what we do is directly aimed at impacting practice, right? We're not signing people up for a degree program, even though many of us work for schools that have degree programs, and that's what we are paid to do as well. This is really about helping professionals develop, and that's what we want to see continue. We also have a new project that's focused on maternal child health surveillance. It's called the Pillars Project. It's a multi-year grant from CDC with more than half of that coming to the Institute to support the staff who are working on the project. What we're doing is we're leveraging work that Sean, Titus, and others have done in terms of creating, especially John Price, and creating a linkage algorithm that can go through the IMPC and link moms and babies together. So we have dyads. So there are things, for example, there's a flag in Epic that allows you to do this, but our algorithm finds more people than Eskenazi has flagged. And we've rolled out version 1 of this algorithm now in the IMPC, and the data analysts can use it. Sean's team will continue to improve that, but we're going to leverage it in our work to take those dyads, and then we can look at specific conditions. So we're going to look at neonatal abstinence syndrome, stillbirth, and congenital syphilis, which are high priorities for CDC through their SetNet project. We can report that data again in a de-identified way to CDC to support national surveillance efforts, but also we can have those data available in a comprehensive way for the Marion County Public Health Department and Indiana Department of Health, who are our partners on this project, to again give them actionable data that they can use to translate into action and change within Indiana. And so we have specific tasks planned to engage partners, community-based organizations, our public health departments, clinicians, and health systems in improving outcomes for these populations. And so we're really excited. We just kind of got off the ground with this work, and we're looking forward to doing it for the next 4 years. I also wanted to highlight one of publications from our public health informatics program that appeared in STD recently. This was work that came from a contract we have with CDC, who wanted to look specifically at treatment rates for gonorrhea and chlamydia. And we know that, for example, not all women who should be tested are tested. Here we looked at who got treatment and who didn't. If you see here a number of Regenstrief staff, John Price, Katie Allen on it, but also our partners, Christine Human, who directs the Bellflower Clinic, Melissa Titus, who's faculty in the Department of Epidemiology, Tom Dzinski in epidemiology, and Goyu Tao, who is our program officer at CDC. So again, this is highlighting the critical importance of partnership in the work that we do. I want to take a moment just to recognize we've had our center has sponsored or been involved with planning a number of events this past year that I wanted to highlight. Last March was an AI conference, and I think Sean is talking with Xiaofin and others about having another maybe larger AI conference that's campus-wide coming up in the future, but we kind of got the ball rolling with a really well-attended AI conference here last year in the building. Similarly, we filled up this room with people from local and state public health jurisdictions from across the state last year and had a fantastic event. And we've got another one coming up that I'll mention this year, and hope to similarly fill up this space. We also hosted a number of visitors through the Sam Regenstrief Distinguished Lecture Series, including Dr. Syra Hake from Pfizer and Dr. Michael Matheny from Vanderbilt in the VA in Nashville. And we were really delighted to welcome them, and they spent time with our faculty. Our students got to know Regenstrief a little bit better and our work, and we hope that that leads to productive collaboration with those institutions moving forward. Similarly, last month, or a little more than a month ago now, we hosted a meeting with the Luddy School of Informatics, Computing and Engineering here on the IU Indianapolis campus. We invited them to come over. We met some of their newer faculty in Luddy, got to know what their research interests are, and looked for those alignments between what we were already doing in CBMI and what they were doing. We've invited those newer faculty that we met collectively in a group setting like this now to come back and come individually to our monthly ongoing CBMI center meetings to present on their individual research topics and have more in-depth discussions with us about their research to generate those collaborations that we hope to have with them moving forward. So we're excited about that gaining steam with Luddy. We also last month hosted the national network meeting for DCIA. There were a number of people here involved in planning that event and making it happen. I got so many compliments from the visitors saying, your building is amazing, your staff are amazing, I really appreciate everything, the food was great, all of it, hotel that you found for us was amazing. So lots and lots of positive feedback from a group that well, half of them are easygoing, the other half of them are hard to get along with. So we pleased even them. Right? You all have research partners and know who I'm talking about. But really, we used the space up on the second floor. So Lori and Donna B. We have a Donna in CBMI who's amazing. We have a Donna in HSR who's amazing. Both of them helped with this meeting. Jenny Crago, a number of others who helped make it possible, and of course our facilities team. So thank you to everyone, and I think they will want to come back. Yeah. Okay, so where are we going? So that's kind of what we've been up to. What are our goals and where are we headed? So looking into the future, we're really focused on several things, including faculty recruitment in some priority areas. So been talking a lot with Kuhn, a lot with other department chairs like Chris and Jali about how we can increase recruitment in some of our priority areas around public health, epidemiology, AI, machine learning, to grow our contingent there. We've had people come in and interview. Some of them have not worked out. We still got more work to do there, more interviews coming up. So we're very excited about growing in those areas and want to grow in those areas. We've also been focused on developing new collaborations and partnerships while sustaining our existing partnerships. So we have a great partnership with Merck. You heard about that at the last REILS, or maybe 2 REILS ago, from Paul Dexter and Jared Baker. We want to keep that going, but also form new ones with Luddy. We had a great iHigh collaborative meeting recently, and then we've been working to develop something similar with Pfizer. So looking to build and expand our partnerships. Of course, we want to keep the funding pipeline going. So our plan for this year was to submit at least 10 new proposals. I think we may be there or very close to that already, with at least 4 of them being funded. So we want to try to continue to be above average, and that's our goal. And then in terms of organization and structure, strengthen our cohesion across our program areas within CBMI, so we all feel like we're kind of one center, even though we spend most of our time in our respective program team environments. And then enhance our presence on the web so that people continue to know what CBMI is doing and what we're up to. And on the education and training side, we want to strengthen our clinical informatics fellowship program and strengthen our broader pipeline into informatics. So that starts all the way with bachelor students here at IU Indianapolis, moving to master's students and PhD or other graduate students like med students, students to postdocs and into junior faculty positions. So really thinking holistically about the pipeline and how we can sustain those activities, but expand them and bring more people into the field. We will be having a retreat next month in about 1 month from now, where we will be talking about our FY25 goals and priorities, how we align what we're doing with the strategic plan. I think, as I mentioned today, we have a number of projects that are focused on learning health systems, health equity that align, I think, pretty well with our overall strategic plan at Regenstrief, talking more explicitly about how to continue that alignment and strengthen it as we move forward as a center. And we'll be having that here at Regenstrief in a month. And excited to welcome our whole center team to that meeting. We also mentioned we have another event that's focused on public health. That's happening also in May, where we are inviting it once again jurisdictions from across Indiana and beyond to come and share about what they're doing in support of CDC's data modernization initiatives. There's lots of activity happening in the DMI space, and we're going to have a whole day focused about primarily what's happening in Indiana, but we also have a speaker coming from the Illinois Department of Health to share what they're doing, and we also have a national speaker as well who will be presenting on what's happening nationally. And then we will also be the site for the Informatics Consortium meeting in May. So my other hat that I wear is as the leader of the Informatics Consortium on the campus. This is where anyone who's involved in informatics can come. It's a big tent approach to informatics on campus. Come and collaborate. Our goal there too is to facilitate collaboration across informatics, health and non-health disciplines in informatics across the campus. And so we will be hosting 2 events, but they're happening back to back here at the Institute. First is a writing workshop. That's where we ask for people to bring something they're working on, a specific games page, a manuscript, abstract, whatever it is, bring that. We'll have senior faculty. We'll divide everybody up in groups and you get feedback, right? Peer review in real time during the event and work on, and then you also look at other people's stuff and give them feedback. And then after the workshop is over, where we're worked on our writing, then we will have more of a networking social event. So if you're not signed up for the Informatics Consortium, you can get signed up. Our website launched this week. Woohoo! And so we now have a web presence through the Office of the Vice Chancellor for Research. And so you can find us, sign up for events and notifications. But so I would encourage everyone with an informatics interest, and you don't have to be like in CBMI to do this, but if you have informatics interest, please join us because we want to build our consortium. So that's all my prepared talk. So we've got at least about 15 minutes for Q&A. So I'd invite you to come up, correct me where I got it wrong, ask a question, or start a new thread of conversation. Thank you. Go. And let me know if there's comments online too. Thank you.
Hi, Brian. That's a lot to digest. When you put the spectrum of programs up front, informatics goes from molecules to populations. So the populations part, I didn't see the molecules part, and yet you've got a fellow who does bioinformatics, and we've got a bioinformatics core of people in our at public health, both in epidemiology and biostatistics. And so is there a plan? I didn't see a plan for that. Is there a plan for that, or is that where does that fit, or is that just outside the realm of CBMI?
Yeah, so good question, Bill. So I wouldn't say that it's completely outside the realm of CBMI. However, a lot of our work on the molecular end happens through collaborations with the CCBB. So the campus has a very large and it's been around for a long time, Center for Computational Biology and Bioinformatics. Kuhn and others are engaged in it. We have other collaborators that are engaged in the CCBB activities. So I would say that that while it's not totally outside our realm, we tend not to prioritize building infrastructure and duplicative services that you can find in the CCBB. So we would rather collaborate with the CCBB rather than duplicate what they're doing.
Just a quick clarifying question for you, Brian. Would it be reasonable to say that in addition to many of the other co-investigators, those projects where you listed my name, actually you are playing a very, very important role on those projects as well? Is that safe to say?
That's
Okay.
safe to say.
Okay, thank you.
Thank you, Brian. This is great to hear all about CBMI and all the great work that everyone in the center is doing. Wondered if you could comment a little bit about just the national/international landscape and where we fit in. I know we have just such a phenomenal reputation, but where do you see us fitting in? We've got a lot of local plus national and international goals, but just maybe what's that landscape look like? What do you see on the horizon that we might be able to think about?
Yeah, so great question. So there's a number of ways. So there's a lot of activity happening in the biomedical informatics space. So AI, I mean, you can't have a conversation in medicine these days without AI coming up. So I think, that's a way that we want to grow in that area, but it's a way that we can continue to expand and do more to support that as the country has conversations around how AI fits into medicine and public health, figuring out that and engaging in those conversations. We also see a lot of activity starting to happen around environmental health and social determinants of health, so non-clinical type activities. We have investigators like Josh Vest, Jill, and others who are doing social determinant work already and can continue to do more in terms of supporting what we see happening at the national level. The Office of the National Coordinator for Health IT just released a draft of its next strategic plan. Marjorie and I were just having a conversation. Like there's a lot in that plan where we can fit in, right? Whether it's HDS or CBMI or even HSR, there's ways that we as an institute can play in supporting where ONC wants to take the U.S. Obviously, our GHI team has its finger on the pulse of the digital health strategies for other countries. So immense opportunity there. At the policy level, we see things like the European Health Data Space, which is trying to get interoperability and data sharing across Europe. There's probably ways that we could plug into that given our expertise. We are, well, I mentioned AI, but it's not just AI like building stuff, but also the policy around it, right? The ONC already has one policy that regulates AI in products that are on the marketplace. There's going to be more regulation in that space. That's a great place for Regenstrief writ large, right? So policy experts, whether that be in HPM or HSR or CBMI, to be engaged in some of those conversations. So I think there's a lot of things that are happening at the national level that we can get plugged in. CDC's data modernization initiative is another one, right? So CDC is spending billions over the next decade on modernizing technology and infrastructure in state and local, tribal, territorial jurisdictions. That it's akin, at least, well, we need as much money as what we spend on high tech for clinical medicine. We need that in public health. We're hoping to get that amount. But if that amount transpires, that'd be a $36 billion that will be invested in the public health infrastructure that we just finished investing in the clinical infrastructure, right? So there'll be more than enough opportunities than what our existing team can handle in that space as that moves forward. We obviously need Congress to give us more money for that, but they have already allocated quite a bit, and many of our jurisdictional partners that we already work with are actively working on those plans and engaging with us to support them in that activity. So I see our center and our institute as potentially playing a pivotal role in a number of these strategies that are happening both here in the U.S. and abroad. Yeah.
Sorry, can't help myself.
No.
A lot of what Regenstrief was known for is the interface with informatics and patient care. Clem built everything within it. Eskenazi Health, and then went, spread to the INPC. But the meat was, at least early on, was at that interface and the collaboration with the health systems. The global health, we're down in dirty in Kenya, developing a health system that's now serving 500 sites in 17 counties, and now is, open arrest gone globally. But it starts with that interface. Who's at the interface between AI and patient care? Are we active in that phase? There's in today's JAMA. There's an editorial by Julia Adler-Milstein on the clinician vigilance of AI.
Yeah.
Because if it's right 95% of the time, it used to be right 95% of the time, and you don't see the other 5% where it's actually making mistakes. So who's living at that interface where we get the most out of it on the help side and the least out of it on the downside, the safety side? The unsafe things. Are we working in that interface, and do we have a partnership with the health systems to begin looking at the effect of AI?
That's a fantastic question. I wish I had more to say that we are today. I think we aspire to be there. I think that, I had a great conversation, have been having conversations with Andrew Gonzalez here about some things he's proposing to do moving forward. We've had there are a number of AI investigators on campus. Not all of them are health oriented, but there's some of these faculty in Luddy that I mentioned who are AI oriented, want to do stuff there. IU Health has a group that's working internally on AI. It'd be great if we could do more things with them more directly. We don't have any kind of formal partnership with them today to do that. I think part of why we want to recruit more AI-oriented faculty into CBMI is to do just that. Because Sean and I and others are engaged in a number of machine learning type projects where we're developing algorithms for various things. Some of that, though, is on the population level outside of healthcare. It'd be great, though, to your point, if we have more some folks focused more at the intersection of care and AI with our health system partners. I think that's absolutely where we would like to go with some of our recruiting efforts and some of our discussions we're having with. I have had conversations with a couple of faculty who are looking at positions at IU to come later this year. If that works out, if they're able to be recruited into XYZ department at the school of medicine, they have an AI interest, and that might be a good way for us to pull some of those new faculty into our center and the work that we're doing. But time will tell on some of those joint recruitments.
I have a couple comments from the online community.
Yes, Beth.
Randall Grout is asking, EH also stood up an AI governance committee, and he leads it. He leads that, and Sean is part of it.
Yeah.
So.
All right. Thanks. Yeah. Thanks, Randy, for mentioning that.
And then the other is certain training activities, postdoc, fellow stipends, faculty time for short courses, etc., requires some funding. What are your thoughts of funding these?
So I would say that the efforts I described are all funded. So our postdoc efforts are funded through the National Library of Medicine. So for our pre-doctoral and postdoctoral fellowship program, our short courses are funded. So the faculty receive an honorarium for teaching each of those courses. I should say whoever teaches it, because they don't have to be faculty. We actually have a staff member who taught one of the courses last year, and I appreciate him stepping up to do that. But there is an honorarium for that, and that's paid out of essentially the tuition or fees, whatever we call it, that IU charges for taking those short courses, right? So we build mechanisms for paying for people's time. We don't want to ask anybody to work for free. And of course, being a soft money organization, we want to make sure we always are covering time and effort that people are spending on projects. So all of these training activities come with are funded for the most part. Now, there are things like we are engaged, for example, with IU Indianapolis's Learning and Health Sciences Internship Program, the LHSI program, and that's where the faculty member can work with an undergraduate student. The student is paid by the university. So the faculty and Regenstrief does not have to pay the student for their work. It comes from the university, but there's no payment for the faculty, right? What you get out of it is you get someone to support and help you with your research, and while you get to mentor them, and it's considered a teaching or training activity of the faculty member. So there are some things that are not fully funded on the time and effort side, but certainly for staff and someone like a postdoc, we make sure that those are fully covered. Yeah, good question. All right. Looks like we are at 1 o'clock. I want to thank everyone for coming today and appreciate your comments and questions.